So one of the day-to-day podiatry typical scenarios is that a patient will come in with a range of either skin or nail lesions. So they might have, as we talked about, fungal nails, or they may have corns or callus that are causing pain for them to walk. Some people just cannot get down to their toenails to cut them. And so we do that job for them. So the first thing that we do, obviously, after getting whatever details we need to from the patient, we need to wash our hands, put on a pair of gloves. We need to clean the patient's foot. And so that we do that with a variety of skin disinfectants. And with our gloves, they must be latex free, because you don't know that the patient may have a latex allergy, or sometimes you develop an allergy yourself. Any instruments that we use come in sterile packs, and that's a sterile pack there. And if we look at some of those instruments just by themselves, they've got the heavy-duty type nail clipper. You've got a black file, which has got a little file on the end of it, so that you can get down the side of the nail and you can file right deep down on the side of the nail, and you can check that there's no spikes or anything down there during your treatment. This is another little file handle where you can add tiny little blades that we use for cutting. And those little blades are very, very tiny, and they come in sterile packs. And so obviously every patient has their own set of sterile instruments that are used on them. Often you'll find that after you've removed skin, you've scalpeled the skin away, a scalpel blade of a variety of sizes and a handle. So you scalpel away, removing all that thick skin, and you smooth it down with a drill and a sanding disc. So it's a little bit like being in a workshop and having sandpaper spinning very, very fast on the end of this drill. So just a bit of noise, and then within that drill you've got a vacuum cleaner. So the dust coming away is sucked into this little area here, and so at the end of every day that's got to be cleaned out and emptied, so that there'll be debris from skin and debris from nails. So there are different drill heads for nails and different sanding discs for skin. And of course, during that procedure, it's always important that the podiatrist is protected using a mask, even though that there's a vacuum cleaner sucking up the debris. You don't want to take the risk of inhaling any of that fine dust into your own lungs. So usually at the end of that, I always like to give just a little bit of a foot massage. Not a big one. And depending on the skin type, there might be a variety of products that we use to do that. The one that I really like is a gel product that dries very, very quickly. And it's not something that you would use on somebody who's got very, very dry skin as a treatment, but as an after foot care, it's great stuff, because within a few moments it's dried on the skin. So when somebody stands on the floor, they're not slipping on the floor. And if they want to use it at home or whatever, again, you've got that little bit more safety feature, rather than having a greasy product that is going to allow someone to slip over much more easily. Sometimes we get situations where it's very difficult to actually see what the problem is, and if that's the case, then we usually bring in this magnifier with a light on it, so that we can get a better view of what the problem is. So that's just simply held down over the patient's foot. Obviously the chair rises and falls back, and so that it gives us a better inspection view, and we can deal with that particular problem more readily. So treatments are often varied, and no one treatment is the same as the other, and obviously each foot's as important as the other one. And the most amazing thing is that on the end of every foot there's a person, and they've all got stories to tell. They have you captured, and it's a really, I think it's a really lovely experience to be able to have an insight on people's life as well as getting your treatment done.